Ready.
Okay, so this is going to definitely be one of the things that I could choose right here as the azygus. Here's the hemiazygus going into the azygus. Here's the accessory hemiazygus coming down to the azygus. Here is the thoracic duct. Okay, that's receiving from most of the body except for the right side. Here's the cisterna chyli. Okay, then here's the ureters on both sides. And then in terms of arterial structure, this is the common carotid, external, internal carotid. The external carotid will go out and become femoral. The femoral vein will receive great saphenous vein blood back into it. Then it will become the external iliac, and the external iliac will join with the internal iliac to become the common iliac. Okay, and then at the way top here, you have to back up a little bit. Here is the subclavian artery and vein going underneath the clavicle, and the subclavian artery in particular is in that space between the anterior and middle scalene going over the top of the first rib. Okay, and it's going to also have the brachial plexus with it. Okay, so then we're going to come over to, you have to be careful and keep it under 10 minutes, the special shiny skull here that has, oh I'm sorry, the circle of Willis. And so how do you get into the circle of Willis? You get into the circle of Willis from the vertebral, going to the basilar, going to the posterior cerebral. The posterior joins with the middle by way of the posterior connecting. Here's the middle cerebral, here's the anterior cerebral, anterior connecting, and then way in the canal down there is going to be the carotid, internal carotid artery. And where's the internal carotid is way down in there. And then here's the external carotid. Here's the arch right here, the carotid arch where there's the carotid sinus. And then the external carotid is going to have, the first one is going to be superior thyroid, and then it's going to be lingual, and then it's going to be facial. And then backwards over this way is going to be the occipital, and it's going to end in a bifurcation at the maxillary going way in that way, and the superficial temporal, and then the maxillary way in there is going to actually have a branch that comes up here through the foramen spinosum, and it's going to be the middle meningeal artery. Okay, and then let's go to this model, and this is the right eye, and so this is the lacrimal gland, and the lacrimal gland is innervated by the facial nerve. And then we're going to have the levator palpebrae superioris, and then we can take off this top here. And what else is there? Here is a superior rectus, and then this comes off, and you can see that superior rectus is going to be hooked in right in here, and this is going to be the superior oblique, innervated by, well, we know all that stuff anyway, I suppose. Not cranial nerve 4, this is cranial nerve 3, 3, 3. Here's the inferior oblique, and that's also going to be a 3. This is number 6 nerve here, because that's the abducens abducts the eye, so that's the lateral rectus. So that pretty much covers that stuff right there. Let's see. Then, where else should I go?
Do this one, this one.
Do this one, this one. Oh, okay. Then, so this is the pancreas. And the pancreas is going to have both, well, in this case it's going to be the enzymatic aspect of it, and so that's going to be innervated by CCK, or not innervated, it's going to be stimulated by the hormone CCK, and CCK is also going to open up the sphincter of Oddi. You might want to back up a little bit there. I don't know how much it might be a little too focused. But anyways, the secretin is also going to cause the release of bicarb-rich duct fluid here. Let's see what else is here. The duodenum, sphincter of Oddi. Oh, and then we have the arterial system here. Oh, this would be where the aorta is, and this is where the celiac trunk is. The celiac trunk has 3 branches. There's going to be the splenic, there's going to be the common hepatic, and there's going to be the left gastric. Okay, so the left gastric is there. This is the superior mesenteric artery coming off the aorta that's not present. The abdominal aorta would be present right about here. Then we have the splenic vein and the superior mesenteric vein that would come together to form the hepatic portal. Okay, and then the liver is going to constitutively make bile, which flows down the hepatic bile duct. Here's the cystic bile duct, and the common bile duct will deliver the bile down here, and so the bile is going to go in with the splenic duct into the sphincter of Oddi, and there's this accessory sphincter right here. What else have I not talked about yet? Then there's the heart, and the external heart is going to have some features that we need to know, like coming from behind the conus arteriosus here, or the pulmonary trunk, is going to be the left coronary artery and the right coronary artery. The left coronary artery is going to branch down here to become the anterior interventricular artery. This is the circumflex branch of the left coronary artery. And then the circumflex branch and the right coronary artery are going to travel in the atrioventricular groove, and on the back they're going to meet up in an anastomosis that will be right here, and this is going to be the posterior interventricular artery. And then on the inside we can see that on the right side of the heart we're receiving blood that needs to go to the lungs, and so we have reception from the superior vena cava, the inferior vena cava, and also from the opening for the coronary sinus back here. It's going to empty in right here, so there's 3 ways of getting in. We're not going to have anything open here, hopefully, in the adult, and so that means the fossa ovalis is closed, and we're going to go through this tricuspid right here. This is the right AV, atrioventricular valve, into the right ventricle, which has trabecular carneae, except for right over here is a smooth area, and that's going to be the infundibulum. And so then there's going to be a contraction which will send the blood out through the pulmonary semilunar valve, the pulmonary trunk, and the pulmonary arteries out to the lungs, back into the pulmonary veins. There should be 2 on each side. Pulmonary veins going to the left atrium. The left atrium is going to be mostly smooth on the inside, no pectinate muscle, and then there's going to be the bicuspid valve, mitral valve, on that one over there, okay? And the left AV is going to come down. Then we're going to have a smooth area in the aortic vestibule, and so when we have contraction, it'll go out the aortic vestibule out to the aorta, and it's going to be the not muscular but elastic artery all the way around this way, and just about this much of these first branches. And so these branches are the brachiocephalic, the right common carotid, the right common carotid will come off the brachiocephalus, and this will be the left common carotid and the left subclavian.